A few days ago, I made a video about E&M codes, evaluation management codes, which are the codes that physician offices submit to insurance companies in order to get reimbursed. And the different codes at different levels either represent a certain amount of time spent on patient care that day or the degree of complexity of the visit. Naturally, the longer the visit, the higher the reimbursement, or the more complex the case, the higher the reimbursement. I recently got a letter from Cigna. Please allow me to read this to you. We routinely review our coverage, reimbursement, and administrative policies for potential updates. In that review, we take into consideration one or more of the following: evidence-based medicine, professional society recommendations, Center for Medicare and Medicaid service guidance, industry standards, and our other existing policies. As a result of a recent review, we will implement a new reimbursement policy, evaluation and management coding accuracy, to review professional claims billed with current procedural terminology, evaluation and management codes 99204 to 99205, which are the high level or prolonged time new patient codes, 99214 and 99215, which are the higher complexity follow-up outpatient codes, and 99244 and 99245, which I believe are higher complexity inpatient codes. I don't know. I don't use those. For billing and coding accuracy in alignment with American Medical Association E&M service guidelines. Effective for dates of service on or after October 1st, 2025, services may be adjusted by one level to reflect the appropriate reimbursement when the AMA guidelines are not met. Translation: if they think you're coding too high, they will downcode you. What this means to you: Cigna Healthcare will conduct periodic claim reviews to verify compliance. Based on that review, providers may be eligible to be removed from the program. Supporting documentation will be requested should we determine the established guidelines were not met. Providers who believe their medical record documentation supports reimbursement for the originally submitted level of the E&M service should follow the reconsideration and appeals process. So, I see a lot of patients who are on insulin, who have complications of their diabetes, retinopathy, eye damage, kidney damage, nerve damage, people who have significant low blood sugars and very high blood sugars, and they are on a medication, insulin, that requires frequent monitoring. This constitutes a high complexity level of care. And all of that is already documented in my notes. However, I do not trust these reviewers one iota to be able to find the proper wording as they would like to see it. So now I have taken it upon myself to make an addendum at the end of every note from now on, stating the criteria that they need in order to see that I am documenting things properly and that my patients are complex and that I should be coding at the level that I am. Does that mean they won't downcode me and try to shaft me out of some money? No, it does not. But at least to give me some ammunition when I try to appeal because they've decided to downcode me. And I don't want to hear nothing in the comments about me just caring about the money. Here's the thing. Endocrinologists are among the lowest paid specialties because we only get paid on our office visits. We don't have procedures to do. We don't do surgery. We don't give infusion. I'll take that back. There are some practices that from time to time will do an infusion, but that pays minimal compared to colonoscopies and cardiac catheterizations and echocardiograms and stress tests that other specialties get to bill for. We don't get that. We only get to bill for visits. And as I said, our patients are very complex, and we are trying to keep them from going to dialysis and needing cardiac catheterization and things of that nature. So we depend very heavily on being reimbursed for our office visits. And we use that money not just for ourselves, but to pay the staff and to keep the lights on and all that jazz. Yeah. So, Cigna, I am looking forward to the appeals.